See how a centuries-old pediatric hospital is making the move to the cloud.
We reduce our cost of 60%.
Coming up next on Health Tech Today. An independent sovereign city-state, Vatican City is located in the city of Rome. Besides its most famous citizen, it's also the home of one of the top pediatric research hospitals in Italy. Founded over 130 years ago, Bambino Gesù Pediatric Hospital began in just one room with 4 beds. Since then, it has grown to serve over 1 million outpatients and is a destination for children from all over Europe who seek pediatric treatment. But until recently, the hospital's email system was nothing to write home about. The IT department faced consistent complaints from the clinical staff. Large file attachments were a problem. Staff couldn't share their schedules easily. There was a lack of storage and issues with spamming. The system definitely needed an overhaul. Joining us today is the CIO of the Bambino Gesù Hospital, Giulio Siccardi. Mr. Siccardi, it's so nice to have you join us.
Welcome to you. I'm very honored to be here with you.
The situation with your old email system sounds like it was a real problem for a busy hospital where the staff need to coordinate smoothly and easily so they can focus on, let's face it, delivering health care. And you were even hearing staff complain, as I understand it, they had better email service at home using free internet software. Is that right?
Yes, exactly. They told us we have to use your system, but your system is not better than other systems, free, available on the internet. And it's very challenging for us because there's a comparison between an internal system provided by us and an external free system provided by Microsoft or other people that is very well performing.
There are a lot of email solutions out there. What led you to Microsoft, and in particular the cloud solution?
We invited Microsoft, IBM, and Google, and we compared the solution in terms of technical aspects, such as spamming feature, capacity of manage attachment. The system must be so easy to use that we don't have to train our doctors. We made demonstration of IBM system, of Google, Gmail, and Microsoft, and the return was enthusiastic for Microsoft. Very easy of use.
So now you've had a chance to actually use the solution in the enterprise, and this certainly was an innovative move on your part because this was an early adoption of cloud-based solutions in healthcare. How has this solution performed, and what are their clinical staff saying about it?
The solution performs fantastic. It maintains. We didn't make training, nothing at all. And our doctors use the solution software in the hospital, at home, at the airport, on the mobile phone.
What about privacy issues and security issues with the cloud-based solution? How did you feel about that in your Microsoft solution?
For us, it's very important that Microsoft manage data in Europe. For us, it's very important that Microsoft told us where are their server farms. Other competitors told us, we don't know where our server farms are. This is our standard contract. We can't change because it's a contract for 1 million of users. Microsoft told us, yes, we have over 1 million of users, but we can personalize the contracts in the respect of the data, of the quality of data we manage.
And did you experience an economic value by making this decision? I mean, for instance, was the move an economical way to implement email in your institution?
Yes, we have two aspects. The first one is the economical aspect, that is, we reduce our costs of 60%. and it's a lot of money for us. But the most important thing is that we have limited resource, IT resources. And the most limited IT resources is human resources. So we don't have to spend human resources in managing email system. This is standard. We have Microsoft that is managing our email system, and we can concentrate our limited human resource in managing specific healthcare applications. So we have more resources to engage in this challenge.
Well, Mr. Giulio Siccardi of Bambino Gesù Pediatric Hospital in Vatican City, thanks so much for being our guest, and congratulations on your continued success. And thank you so much for joining us on Health Tech Today.
Thank you to you. And our success is determined in this case from Microsoft. Thank you, Microsoft. Bye.
On behalf of Microsoft Worldwide Health, our staff, and our sponsors, I'd like to thank you for joining us. We always enjoy hearing your feedback. We'll see you next time for another episode of Health Tech Today.
For more thoughts, comments, news, and reflections on healthcare IT, join Dr. Bill Crounce on Health Blog.